Cryos is dedicated to providing the most advanced technology in reproductive cryopreservation techniques and providing the opportunity for our clients to use these techniques at home. The donor sperm undergoes a very rigorous selection process and represents sperm quality in the top quartile of men. This sperm is then preserved, and the process allows the sperm to stay preserved for decades. For home insemination, Cryos provides the ability for you to choose to use our home insemination kits in the privacy of your own home, or seek treatment at a fertility clinic. The choice depends on numerous factors such as your personal preferences, financial, country legislation, fertility clinic options, as well as your own fertility, and thereby chances of becoming pregnant. The first step in home insemination is to remove the straw from the packaging and allow the straw to sit at room temperature for 15 to 20 minutes. This can be done by simply setting the straw on a clean surface. The kit also comes with an adapter, a syringe, and an alcohol pad. Fit the thick end of the adapter onto the end of the syringe. After letting the straw sit for 15 to 20 minutes, clean the straw with the alcohol pad by covering the entire surface at least once with the pad. There's an ID number or name on one end of the straw. Identify it. On the opposite end of the straw, use a pair of scissors to cut the seal end. Place the now opened cut end into the thin side of the adapter. At this point, it's important to know what kind of straw you have. If it is a 0.5 milliliter straw, cut the straw 2.5 centimeters from the top of the straw. This is on the other end of the straw that's still closed. If you have the 0.4 milliliter straw or IMV straw, cut just below the plug, under the ID number. Now draw the sperm into the syringe. Keep the syringe upright so everything you pull from the straw goes into the syringe. Pull until the straw is empty. The syringe will allow for up to 2 straws to be drawn at any one given time. However, if you're using 2 straws, draw the syringe to the 0.5 milliliter mark, stop, and then repeat for the second straw. There might be a little sperm left on the inner sides of the straws, but the combined volume of the 2 straws will be plenty of total sperm to provide a chance to obtain pregnancy. Other procedures conducted at fertility clinics such as IVF or intracytoplasmic sperm injection have increased chances to obtain a pregnancy due to the character of the insemination and fertilization. For home insemination, also called intracervical insemination or ICI, lie down on your back in a comfortable position. Raise your hips with a pillow to get a downward trajectory with the placement of sperm. Insert the syringe as far as possible into the vaginal canal. Slowly inject the contents of the syringe, then slowly remove the syringe, and lay still in place for approximately 30 minutes. Ideally, insemination will take place when you're ovulating. However, sperm can live in the female genital tract for 1 to 3 days, so if you miss the exact moment of ovulation, don't worry, you can still use the technique outlined. If you have regular ovulation cycles, there are many available ovulation tests that will give you a time to perform ICI. The insemination should take place 24 to 36 hours after a positive ovulation test. Usually, ovulation occurs between 13 and 14 days after the first day of a menstrual cycle. However, this can vary significantly between women. If you don't have regular periods, then you may want to speak to your gynecologist or reproductive endocrinologist about further testing that may be necessary to determine any barriers to ICI. ICI inseminations may be performed with each regular ovulation cycle, though if this process fails to achieve pregnancy after a few tries, we strongly encourage evaluation by your treating physician. We encourage this beforehand to make sure conditions are fine to conduct home insemination. All the information discussed is available on the Cryos website. From the homepage, scroll down to the Resources tab. Then, select the Information/Folders tab, and select the appropriate instruction manual language for further information. And remember, if there are any questions or concerns, feel free to contact Cryos International.